At HCG, we are committed to fostering human dignity and preserving the rights of every patient. Patients are entrusted to our care and deserve to be treated with respect and dignity. Just as how we expect our patients to be reasonable and responsible, our staff are also trained to respect the rights of each patient and support them. Patients have a right to receive treatment irrespective of their type of primary and associated illnesses, socioeconomic status, age, gender, sexual orientation, religion, caste, cultural preferences, linguistic and geographical origins, or political affiliations. Right to be heard to his or her satisfaction without the doctor interrupting before completion of narrating their entire problems and concerns. Expectation from the doctor to write the prescription legibly and explain to the patient on the details on dosage, do's and don'ts, and generic options for the medicines. They have to be provided with information and access on whom to contact in case of an emergency. Right to personal dignity and to receive care without any form of stigma and discrimination. Privacy during examination and treatment. Protection from physical abuse and neglect. Accommodating and respecting their special needs such as spiritual and cultural preferences. Right to confidentiality about their medical condition. Patients or their family members have the right to receive complete information on the medical problem, prescription, treatment, and procedure details. A documented procedure for obtaining patients or their families' informed consent exists to enable them to make an informed decision about their care. Patients have to be educated on risks, benefits, expected treatment outcomes, and possible complications to enable them to make informed decisions and involve them in the care planning and delivery process. Patients have the right to request information on the names, dosages, and adverse effects of the medication that they are treated with. Patients or their authorized individuals have the right to request access and receive a copy of their clinical records. Patients have the right to complete information on the expected cost of treatment. The information should be presented as an itemized structure of the various expenses and charges. Patients have the right to information on hospital rules and regulations. Information on organ donation. Patient has the right to seek a second opinion on his or her medical condition. Right to information from the doctor to provide the patient with treatment options so that the patient can select what works best for him or her. Patient has the right to justice by lodging a complaint through an authority dedicated for this purpose by the healthcare provider organization or with government health authorities. The patient has the right to a fair and prompt hearing of his or her concern. The patient, in addition, has the right to appeal to a higher authority in the healthcare provider organization and insist in writing on the outcome of the complaint. The patient should be honest with the doctor and disclose all family medical history. The patient should be punctual for appointments, comply with the doctor's treatment plan, have realistic expectations from the doctor and his treatment, inform and bring to the doctor's notice if it has been difficult to understand any part of the treatment or of the existences of challenges in complying with the treatment, display intent to participate intelligently in medical care by actively involving self in the prescribed do-at-home activities. Do everything in capacity to maintain healthy habits and routines that contribute to a good health and take responsibility for one's health. Make a sincere effort to understand therapies which include the medicines prescribed and their associated adverse effects and other compliances for effective treatment outcomes. Will not ask for fake bills and false certificates or advocate forcefully by unlawful means to provide one. If unhappy, will inform and discuss with doctor. Report fraud and wrongdoing. Respect the doctors and medical staff caring and treating. Abide by the hospital rules. Bear the agreed expenses of the treatment that is explained in advance and pay bills on time. It is a constant endeavor of all of us to make care transparent.